My name is Leonard Feld. I'm a practicing dentist for over 40 years, and I have moved into semi-specializing in TMJ, sleep, and TMJD, which is temporomandibular joint dysfunction. Patients come to me a lot of times as their last resort. They've been to many places seeking help, trying to get help. The patients come to me with headaches that no one seems to be able to help, or backaches, neck aches, shoulder pain, memory loss, dizziness. They can't open their mouth. And some of these are obvious, but a lot of them are not obvious. And so when they come to me, it takes a little bit to try and figure out what we got. Because if they can't open their mouth, there's obviously, that's a problem with the jaw. If you can't open it, either you've had a stroke, you have a brain dysfunction, or there's just a physical phenomenon with the mechanism of the jaw joint. With this mechanism, you have all these other things that happen by virtue of the jaw being out of whack or out of position. The modality basically are oral appliances that changes the position of the jaw. The one thing that keeps me going, I think more than anything else, is these people that come to me as a last resort. We help people that seem to be having challenges getting help. Andy came in a wheelchair. He couldn't stand, couldn't walk, he lost his life. He couldn't step up the curb. We had to have two people help him come in with his walker, and then they put him in a wheelchair to bring him in here. It took us a year. And now he goes to the Grand Canyon for their honeymoon. Their second honeymoon, after being married for 50 years. I feel like I've done something that others couldn't do. If you're at the point of saying, you know, I just don't feel good, that, you know, some of the things that I've mentioned, give us a call or find someone in your city that is board certified, that has been trained, that can answer these questions. I'd go to a website of the American Academy of Craniofacial Pain and find a doctor in your area, a dentist or a physician that has been trained and is board certified in TMJD. There are doctors out there. There's at least 10 doctors in your state. The biggest opposition, I think, is just not knowing. And if you don't know, and there's an old saying, you're down on what you're not up on. So if you don't know, and you can't get any help, I hope you take a look at this. You have nothing to lose.